First question, how much visual field is the minimum required for good mobility and safe orientation? Option A 10 to 20 degree, option B 20 to 50 degree, option C 90 to 140 degree, and option D 140 to 180 degree. Correct option is option B 20 to 50 degree. Next question, which of the following ophthalmic lens material should be recommended for the monocular patient? Option A crown glass, option B polycarbonate, option C high index plastic, and option D RGP contact lens. Correct answer is option B polycarbonate. Next question, which of the following is generally not accepted as an orientation and mobility system for people with visual impairment? Option A sight guide, option B guide dog, option C electronic travel aid, and option D echo travel. Correct answer is option D echo travel. Next question, the Snellen's chart measures option A ocular pressure, option B cognitive ability, option C functions of daily living, and option D distance vision. Correct answer is option D distance vision. Next question, when corneal light reflects falls on limbus, what will be the angle of deviation? Option A 15 degree, option B 30 degree, option C 45 degree, and option D 60 degree. Correct answer is option C 45 degree. Next question, in case of squint examination of child, refraction should be performed. Option A subjective refraction, option B undilated retinoscopy, option C cycloplegic refraction, and option D none of them. The correct option is option C cycloplegic refraction. Next question, in a Krimsky corneal reflex test, the prism placed in front of option A deviated eye, option B fixing eye, option C both of them, and option D none of them. Correct answer is option B fixing eye. Next question, in which type of squint amount of deviation remains same in all direction? Option A concomitant squint, option B comitant squint, option C paralytic squint, and option D none of them. Correct answer is option B comitant squint. Next question, increased accommodation is associated with option A exophoria, option B esophoria, option C hyperphoria, and option D hypophoria. Correct answer is option B esophoria. Next question, cyclophoria means option A upward deviation, option B downward deviation, option C torsional deviation, and option D A and B both. Correct answer is option C torsional deviation. Next question, heterophoria means option A manifest squint, option B latent squint, option C paralytic squint, and option D none of them. Correct answer is option B latent squint. Next question, if due to any reason a child cannot use one eye for 7 years of age, what condition will develop? Option A amblyopia, option B suppression, option C diplopia, and option D abnormal retinal correspondence. Correct answer is option A amblyopia. Next question, which is not an amblyogenic factor? Option A visual deprivation, option B light deprivation, option C abnormal binocular interaction, and option D mental retardation. Correct option is option D mental retardation. Next question, abnormal retinal correspondence is a option A cortical inhibition of image, option B partial loss of vision, option C extrafoveal fixation of one eye, option D coordination of one foveal or other extrafoveal fixation of eye. Correct answer is option D. Next question, which statement is true about low vision chart? Option A, this chart gives the percentage of loss of vision. Option B, magnification required by particular person. Option C, A and B both, and option D, none of them. Correct option is option C, A and B both. Next question. Which low vision patient would most likely experience the most difficulty in driving with the city traffic? Option A, a patient with advanced glaucoma. Option B, a patient with ocular albinism. Option C, a patient with congenital nystagmus. And option D, a patient with monochromatism. Correct answer is option A, a patient with advanced glaucoma. Next question. When esotropia develop in 2 to 3 years of age, it may be option A, congenital esotropia, option B, accommodative esotropia, option C, A and B both, and option D, none of them. Correct option is option B, accommodative esotropia. Next question. In which condition primary and secondary deviation will be equal? Option A, concomitant squint, option B, incomitant squint, option C, paralytic squint, and option D, A and B both. Correct answer is option A, concomitant squint. Next question. Right hyperphoria means option A, right eye deviated upward, option B, exophoria, option C, left eye deviated upward, and option D, esophoria. Correct answer is option A, right eye deviated upward. Next question. Abnormal interpupillary distance will cause option A, amblyopia, option B, uniocular polyopia, option C, suppression, and option D, heterophoria. Correct answer is option D, heterophoria. Next question. When normal eye is covered, object appears double. Condition is option A, binocular diplopia, option B, crossed diplopia, option C, uniocular diplopia, and option D, B and C both. Correct answer is option C, uniocular diplopia. Next question. A temporary active cortical inhibition of the image of an object in retina of squinting eye is known as option A, amblyopia, option B, suppression, option C, diplopia, and option D, abnormal retinal correspondence. Correct answer is option B, suppression. Next question. Giant papillary conjunctivitis is more common in option A, soft lens wearer, option B, hard lens wearer, option C, A and B both, and option D, none of them. Correct answer is option A, soft lens wearer. Next question. Functions of wetting solution is option A, wetting agents, option B, antimicrobial agents, option C, buffering and thickening agents, and option D, above all. Correct answer is option D, above all. Next question. In which occupation contact lens use is indicated? Option A, high altitude flyers, option B, automobile mechanics, option C, construction workers, and option D, sportsman. Correct answer is option D, sportsman. Next question. Properties of ideal preservatives are option A, non-irritant and non-toxic, option B, have broad spectrum antimicrobial activity, option C, be compatible with both thermal and cold disinfection, and option D, above all. Correct option is option D, above all. Next question. Ethylene diamine tetraacetic acid is a option A, chelating agent, option B, remove calcium ions, option C, enhances antimicrobial activity in wetting solutions, and option D, above all. Correct option is option D, above all. Next question. Scleral lens mainly used for option A, keratoconus, option B, irregular astigmatism, option C, therapeutic purpose, and option D, above all. Correct option is option D, above all. Next question. When the curvature of both surface of contact lens is same, then the lens is called option A, afocal segment, option B, focal segment, option C, both of them, and option D, none of them. Correct answer is option A, a focal segment. Next question. Which preparation of hyperosmotic agents is frequently used as intravenously? Option A, glycerol. Option B, mannitol. Option C, urea. And option D, isosorbitol. The answer is option B, mannitol. So please like, share and subscribe our videos. Thank you.